Hi, everyone, and welcome to this webinar, Ending HIV Criminalization, Lessons from Zimbabwe. My name is Edwin Bernard. I'm the Executive Director of the HIV Justice Network, and together with our HIV Justice Worldwide Coalition partners, we work globally to end HIV criminalization. And today I'm delighted to be able to introduce a video and case study about Zimbabwe. But before we do that, there's some housekeeping. First of all, there is live interpretation into French, and hopefully the instructions you can see in front of you. Just so you know, this is a webinar and not a Zoom meeting. So it means that those of you who are attending are muted. So if you have questions, and I hope you have lots of questions for us, please use the Q&A box that is at the bottom of your screen. If you ask questions in the chat box, we won't be able to see them or answer them. So if you have specific questions for our panelists or for me, then please put them in the Q&A box. And there will be time to answer, hopefully, as many questions as we can later in the webinar. And the recording of this webinar will be available on the IAS Plus platform. So we're meeting today during a particularly problematic time in the HIV response. We have to acknowledge that with the change in US policy, things are not going as smoothly as we might hope. Although there's always been challenges, it feels like right now we're facing enormous challenges. But the challenge of HIV criminalization continues, and the work to end HIV criminalization remains important. So last Friday was the second International HIV is Not a Crime Awareness Day, which takes place on the 28th of February. And of course, on the 1st of March, we had Zero Discrimination Day. And for those around those 2 days, that's the reason why we're having this webinar today. I want to thank the IAS Heart of Stigma program for hosting this webinar with us and for supporting the work that we're doing today that we're highlighting on this video that we'll be sharing and a new case study on how Zimbabwe decriminalized HIV. But before we explore the video and the case study and introduce the panelists, I'd like to welcome Marlène Bras, who's the Director of HIV Programs for the International AIDS Society. Welcome, Marlène, over to you.
Thank you very much, Edwin. And good morning, good afternoon, good evening to everybody joining us today. On behalf of the International AIDS Society, I'm delighted to welcome you to this very important webinar co-organized with the HIV Justice Network. And I have to say that it is a real pleasure to be working once more with the HIV Justice Network. The HIV Justice Network does such an important work coordinating and strengthening the global response to punitive laws and policies that impact people living with HIV. So today we delve into a very, very important issue at the intersection of human rights, public health, and justice, HIV criminalization. And we're here today not to discuss only the harm that punitive laws cause, but also to highlight the inspiring progress made in Zimbabwe, a country that has demonstrated how evidence, advocacy, and resilience can drive change. Ending AIDS as a public health threat requires a comprehensive approach, and all elements in the HIV response are complementary and essential. And HIV criminalization directly undermines our collective progress. across the world, people living with HIV continue to face unjust prosecution under laws that are rooted in stigma and discrimination rather than science. And these laws do not prevent HIV prevention. We know that. They do not, prevent HIV transmission. Rather, they fuel fear and discourage people from accessing the HIV services they need. And they really contradict decades of scientific research and undermine human rights-based public health responses. There is substantive evidence demonstrating that decriminalization improves health outcomes and is cost-effective, but we need more studies to continue strengthening this case. At the International AIDS Society, we firmly believe that progress happens when science, policy, and activism come together. We use our programs on our convening platforms to share evidence on effective practices in stigma-free service delivery and the positive effects of decriminalization. Our Heart of Stigma program focuses on HIV-related stigma and discrimination reduction, and our journal, JIS, published in 2018 with actually in collaboration with the HIV Justice Network, the expert consensus statement on the science of HIV in the context of criminal law to address the misuse of HIV science in punitive laws and prosecution against people living with HIV. And we've just published a viewpoint titled, "We Will Not End AIDS, Addressing the Anti-Rights Movement for HIV is Not a Crime Awareness Day." So we know advocacy and research go hand in hand, and today's discussion will showcase how evidence-based advocacy has helped drive change in Zimbabwe. Zimbabwe really offers a powerful example of what is possible when communities, researchers, policymakers, and advocates work hand in hand. It is a lesson in resilience and a testament to what we can achieve when we unite evidence with advocacy. So I really hope that today's discussion will inspire all of us to push forward in our own countries and communities, ensuring that the response to HIV is driven by science, justice, dignity, and human rights. Thank you all for being here, and I will now hand over to Edwin to lead us in today's discussions. Thank you very much.
Thank you, Marlene. Always a pleasure to work with you and with the International AIDS Society on ending punitive laws and policies that impact people living with HIV, and the expert consensus statement that we worked together with you and UNAIDS and the International Association of Providers of AIDS Care, IAPAC, in 2018 has made a huge impact, both in court cases, but also in changing the narrative around HIV criminalization because of the power of leading scientists, the 20 leading scientists who collaborated on that statement. So thank you for that, and that work continues. In fact, the statement was used as part of advocacy in Zimbabwe. And today what we're going to do is explore Zimbabwe's journey to decriminalization, as well as resisting recriminalization. We'll hear more about that in a moment. And we're going to watch an excerpt from a new documentary that we've produced with support from the International AIDS Society. And then we'll have a discussion with some of the people who were involved in the video, both who appear in front of the camera as well as who worked behind the camera. So very soon we'll hear from, we'll meet Dr. Ruth Labode, who's a former legislator and chairperson, who was formerly the chairperson of the Parliamentary Portfolio Committee on Health in Zimbabwe, who really played a huge role in repealing the law. We'll also hear from Immaculate Awomagisha, who's a lawyer and human rights activist from Uganda, and also who sits on our supervisory board at the HIV Justice Network, and also from Alison Symington, who I'm going to ask to join me now for a moment, who's our senior policy analyst. Alison worked on the briefing paper and also with our video consultant, Nicholas Feustel, to produce the documentary. Alison, I just want to ask a little bit about how you went about putting this briefing paper and the documentary together before we see an excerpt.
Great. Thanks, Edwin, and hello to everyone. Thanks for joining us today. So our approach to this was really, let's learn what worked. Often when we're working on HIV criminalization, we're focused on injustice and harms, and we know there's so many different countries where advocates are working on this issue, but there's been a big success in Zimbabwe. So we thought, let's find out what they did. Why did it work? What were the key factors? And what can the rest of us learn from what they did? So over the course of a couple of months, I worked with Nick and we spoke with people who were on the ground, who were involved in the cases and the lobbying and the campaigning, and gathered both, the story of what happened, but also their insights on what the key factors were and what led to the success. And then we've put those together in a short briefing paper and a video to share so that we can all learn from that success and pick and choose the things that might help in our own context, because as has been mentioned, this is an ongoing piece of advocacy and campaigning globally, which is really, really important and critical to getting to ending AIDS. So that's what we sorry, and the other thing I wanted to mention is in terms of the people we spoke with, some of them you'll see in the video today, and then there were also a few others that are mentioned in the briefing paper as well, so you can get a sense of different people who were involved in the campaigning and advocacy.
Yeah, thanks, Alison. So the full-length video documentary is around 24 minutes. Of course, we couldn't show all of it, so we have picked I think the middle 12 minutes, and basically, so the beginning of the video highlights the reasons behind why the law was enacted, the problems with HIV, with the law and with HIV criminalization. But what we wanted to show today and then discuss in much more detail is actually how hearts and minds and laws, the law actually were changed, who were the players, and understanding how this could be relevant to the many other countries around the world. There are 80 countries with HIV-specific criminal laws. 90 countries around the world have prosecuted people living with HIV, and only around half have used the specific criminal laws. So there's a lot more work still to be done. So what I'm going to do now is ask Nick to start playing the video, and you're going to see an excerpt. This is a world premiere. The video was only finished yesterday. So here is It's Time, How Zimbabwe Decriminalized HIV. So at what point did you start to understand that this law was doing more harm than good, especially to the women that you wanted to protect?
Yeah, and then time went by, I left my job. Then I got into politics. Then I got to parliament. I was taken to a meeting. I was told I was going to present on criminalization and decriminalization. So I thought about it. Then I started reading a few articles. And I said, okay. I realized then that yes, we had achieved in putting in a law, but definitely the law, according to the data coming out and the investigations, research results, we are not achieving what we wanted to achieve. The infection rate is still there. And also, we do not have the technology to identify who infected who. For all we know, we are throwing into prison the wrong people. And women have become a victim of the law because they fall in love. Then the woman gets pregnant, goes for the antenatal clinic, she's told she's positive. A woman would go back to the husband and say, the doctor said we can live with this, but the men will run to the police. And in Zimbabwe, the person who got to the police first was the innocent one. So when we were in that workshop and I listened to other countries, I was so ashamed of myself. I really made up my mind. I said, when we get to Zimbabwe, let's have a workshop.
It's a very emotive issue, particularly with the public. And legislators are convinced or affected by public opinion. So it was also important to have the public educated about HIV and the effects of criminalization, so that the members of parliament would not feel that they are going against, their constituencies.
What National AIDS Council did is that they would hold trainings, sensitization trainings, to train media practitioners and media house editors, because they're the fourth estate and they had ready platforms through which there could be verifiable information that would then be disseminated. We sensitized the media practitioners, members of parliament, and the Parliamentary Legal Committee to advocate for the repeal of Section 79.
The community mobilized itself, because part of the process for lawmaking in Zimbabwe is public consultations. And so they actually took charge or took advantage of that opportunity to engage with the legislators. And it was important because the legislators were able to see that the communities that are most affected are the ones that are actually advocating for the repeal of this law.
I had already set up in Parliament a group of champions called Sexual Reproductive Health Champions, all civil society organizations working in SRH. We started having meetings almost every month. My job was to face the Minister of Justice. I come from the opposition. As a member of parliament, you must always depoliticize health. And how do you do that? Get into a relationship with a minister. Because in Zimbabwe, parliament cannot bring a case or change a law without the relevant minister literally bringing it to parliament. We can lobby, and we are lobbied also by civil society and the public. And then we start lobbying the minister. Simultaneously, the public can also lobby the minister. I remember sitting in the minister's office explaining all these things. And then he said, okay, I hear you. And then he didn't say anything. Then one day, just in the parliament grounds, he saw me, he said to me, it is time. I said, it is time for what? He says, I'm repealing Section 79. From that time until the first reading, we had 3 or 4 workshops, because all the civil society organizations involved in sexual reproductive health put in their money in training, CBOs, training through the whole country. We printed a pamphlet. The pamphlet went all over the country.
There were pamphlets that were created in collaboration with Zimbabwe Lawyers for Human Rights and HIV Justice Worldwide, with SAL, Karasa, and they were aiming at all the different issues that were involved with criminalization. So they were packaged differently depending on who they were aimed at. So there were pamphlets for the legislators. There were pamphlets targeting the medical profession. They also mentioned the science around HIV criminalization. They mentioned the expert consensus statement, and that was important to indicate where experts' opinions were. They also mentioned the comparative analysis, like the regional consensus around HIV crim, looking at laws that had been passed to decriminalize in other countries, looking at criminal cases that had come before the courts, and where the courts had actually referred to the science around HIV and the problems with HIV crim.
But I must give it on to network of people living with HIV, because they made the change by standing up in public hearings and saying, I'm HIV positive. I have a potential of being arrested because you people know I'm HIV positive. I'm a potential of being accused by this law. So that touched people.
When the opportunity arose to have some conversations around willful transmission and repealing that section, a lot of stakeholders actually invited ZNMP Plus to be part of that, because there was no way they could have done that without the coordinator of people living with HIV in Zimbabwe. what we did was to empower the expect clients, some of those people who had experience in living with HIV. And the most encouraging thing about that was we also had discordant couples who were willing to give evidence. The wife is HIV positive, the husband is HIV negative, and they will come together and give their evidence to the parliament. And so those are the things that helped a lot in terms of empowering the constituents and convincing the policymakers. The community was able to articulate that. We also had community engagement meetings with the general community. What we did was to sensitize and also raise awareness among community members that being HIV positive is not a death sentence. People living with HIV can actually live full lives, just like anyone who is HIV negative, as long as they are on treatment. That helped a lot, and it brought confidence among the constituents of people living with HIV in Zimbabwe.
The repeal of Section 79 was done in a sort of indirect way through a new marriage law that was being promulgated. And in effect, it was a separate section that had nothing to do with everything else. And it was just a few words, just to say Section 79 being hereby repealed. It could have been perhaps to avoid the public backlash, so that only the people who had been involved in the advocacy actually noticed.
I loved the public hearings, I must say, because people were singing outside. There were those singing, condemning the marriage bill. There were those who were condemning, some of us saying, we have these doctors who want to allow people to spread HIV anyhow. They were singing. And it was beautiful though, outside.
After we had done all this work, I actually also then went again after the law was repealed. We did further media campaigns and sensitizations to further amplify to the community and to encourage people to go out there and get tested, to get on treatment, and to share their statuses with partners. And along the way, somehow, we were surprised to learn in March 2024, I believe, that there was an attempt to reintroduce criminal penalties for HIV transmission.
There's a double-edged sword in that because of the indirect way that it was repealed, it's possible that a lot of people that are important in terms of lawmaking did not quite understand the rationale for the repeal of the law. And that is probably why barely 2 years later, there was a sort of reintroduction of HIV criminalization.
Some people called me and said, are you aware that the law you repealed is coming back into power? Then I phoned the Minister of Justice and I made an appointment. And then he said, Ruth, somebody has been naughty and he added HIV to Section 78, where it was never, which means the person wasn't happy with what we did and they were hoping that nobody would notice and then to be made law.
In response, the HLPC team took actions such as further media campaigns and community forums where we were trying to speak in the community to say, hey, what's happening? We even did a joint statement with the HIV Justice Network where we were outlining why the good that was done by repealing Section 79 should not be undone by introducing an amendment.
The minister, who is the same minister who had actually championed the repeal of Section 79, then indicated that that wasn't the intention of government to recriminalize, and that it was probably an error that happened with drafting. And so at the end of the day, that provision that added HIV to Section 78 was taken out.
So there are still around 30 countries on the African continent that have HIV-specific criminal laws. What messages would you like parliamentarians in those countries to hear so that they too can end HIV criminalization?
No, the message I'll send to them is that some of us did advocate for criminalization because there was no solution. It was just a dire situation. And now we have control programs, HIV control programs that work. Get yourself tested, get yourself on treatment. Things are different. There's so much available for you to survive. There is no need for you to criminalize somebody.
So there you have the excerpt from the new video, and as you saw, the full-length version of the video of the documentary is available now in our YouTube channel. We've just published a news story announcing the case study and the documentary. Those are now in the chat. The links to those in the chat. I'd now like to invite one of the stars of the documentary, Dr. Labodi, to join us, as well as Immaculate, who is in the documentary, but only at the beginning and at the end. So you didn't get to see her during the screening. But please join me now, Immaculate, and Alison, please join me again. So we can have a conversation about not only the process, but also the possible implications of the change in the possible changes in the HIV response that have happened in the past few months. I think it's the elephant in the room that we can't ignore, that whilst we're working to improve the legal environment for people living with HIV and people at risk of HIV to access treatment, and that HIV criminalization is a barrier to that. And Dr. Labodi, you said at the very end of the clip that we showed, one of the main arguments that you would say to policymakers about why there shouldn't be HIV criminalization is because we have successful HIV control programs. Many of those now in your country and in Uganda and around the continent are at risk. So does that message still stand? Dr. Labodi.
Yes, the message still stands. And Zimbabwe has reached its 95-95 goal. And I strongly believe just by decriminalizing, we opened a floodgate for people to voluntarily and freely go and be tested. We have so many test centers, but people were afraid that in the event I'm implicated in a case, the police can actually go and find my name somewhere. So people were not willing to know whether they were positive or negative. And that impeded the program because we needed everybody to get on treatment.
Yeah.
So it's valid even now. And I see, when I look around, even in Zimbabwe, you don't see sickly people. You see happy people. There's the association of people living with HIV are comfortable. They are in a lot of forums talking about these issues because they know nobody will get you arrested for it. It's a disease like any other disease. It's as good as diabetes.
So, Dr. Labodi, at the beginning of the interview, which we didn't show during this clip, I asked you about how you changed your mind, because to begin with, you actually supported the idea of HIV criminalization. And I wonder what messages you would want to give now to fellow parliamentarians and also people on this webinar about what it was that made you think the law could make an impact for HIV prevention, and why you changed your mind. Because we know, based on the evidence that we have, the studies that we do, that HIV criminalization only does more harm than good. But how do you persuade people who might believe that the criminal law is a good idea?
My background, I once ran an infectious disease hospital at the early stage of HIV the pandemic, if you want to put it that way. It was a TB hospital, so a lot of our TB patients were actually HIV. That's why they found themselves isolated in that place. And I had a specific case where some guy had been working in South Africa and had come to Zimbabwe. When we tested him, he was positive. And the wife kept on nagging me, saying, "Doctor, the normal TB, when you take TB drugs, you get well. What is wrong with my husband?" And when she's gone home, I'll talk to the husband and say, "Just tell your wife, she will support you." And the man said, "Over his dead body." I was furious. I was angry because I could see when this man gets a little bit better here, he's going to go home and sleep with this woman and not tell her. So when the Zimbabwe Women Organization started lobbying for criminalization, I joined them. I started doing that. And I remember vividly, there was then a law of privacy. But I told that man that I'm about to tell your wife the truth. Then he said, "You dare me, I'll get you arrested." Somehow the wife, I think, figured that there was war between me and the husband. And then she concluded one day, looking at me, she says, "I know my husband is positive, but nobody's telling me. But if," finally I told her, I said, "You are on the right path." Then the husband told the wife that I'm going to sue that doctor. And the wife said, "I will deny it, that she never told me anything. So you better actually just get better." He did get better. Unfortunately, he died later. That happened to me as a clinician. Then when I go to parliament, now as the law had been passed, we had criminalized quite okay. But the law now I was in parliament, I was seeing the other side of the story. That actually, what we thought we could do, we could stop women or men being infected willful, was not helping us. In fact, it was worsening the situation because people will not go for testing, and the lot of women who are, when they are in a relationship, they are honest, they are faithful, will find themselves in jails. And of course, a lot of women were in Zimbabwe in jail. At least there were more women than men. And the judges, once the parliament then was attached to the judiciary, the parliament, some Supreme Court, I think. One day a judge just called me as I was entering my car. He said, "Doc, why are you throwing innocent people in jail? How do you know the person you brought to me, whom I've thrown in jail for 25 years, was the person who infected the other person?" I looked at that judge. I said, "Okay, that's good. Thank you very much." Then the conversation was still going on, but it was good to know that even the very people who are making that decision to finally incarcerate people are not happy. They can see the loopholes. And so what I've seen personally is that after we fought this battle, we have galvanized the nation. Ministers, the very people who wouldn't talk about HIV now, they talk freely about it. In parliament, it's like talking about diabetes or hypertension. And that is important because it means anytime if you feel you are not okay, you are tested and you are positive, you go for treatment, which is fine.
Indeed. So, Dr. Labode, I just want to bring in Immaculate now, who has been working on this issue for a long time, is in Uganda, to highlight why HIV criminalization is a problem in your country and particularly for women.
Yeah. Yes. So thank you, Edwin. And I must start by thanking Dr. Ruth. And I'm privileged to meet her for the second time. First time we met in South Africa, speaking again passionately on why we need to decriminalize and now online. So for Uganda, I wish we could pick learnings from what happened in Zimbabwe and the gains that they've got immediately after decriminalizing. we tried in 2014, we petitioned, we went to court. HIV science came, we put in evidence, we showed expert evidence, we had expert consensus. But I think the time and the environment by then, the legislators, the judiciary did not appreciate what it means to bring science into HIV and apply it into the HIV science and apply it into criminal laws. And they ruled against us. We never got the judgment in our favor. We have been in the process of appealing up to date. But interestingly, 2023, when we had the petition on the homosexuality law and the UNAIDS put in they came in as friends of court. For the first time, court considered their opinion, and the opinion was purely based on science. And based on the fact that criminalization does not actually work, people need to be supported to be retained and put into care and be able to sustain them into care. And we got that small gain. And for us, I think that was a wake-up. It's a wake-up call that we need to bring back this conversation into the space. Interestingly, again, for Uganda, the HIV Prevention and Control Act, which is a specific law, is now due for review. And we are engaging the law reform to make recommendation to Parliament that they need to review this law. And what that means is that for all the cases that we handled, you asked about what does it mean for women. All the cases that we handled, including the late nurse, may her soul continue to rest in peace, Namubiru, is that the first culprit of people who were criminalized were all women. And they are all women because they are in places of care. You're taking care of a baby, you're in hospital, you're the first one to get to know your HIV status. And that hasn't changed. Still, the women that get to know their HIV status, and Dr. Ruth emphasized it quite a lot. So we need to, again, the process now is, how do we pick learnings from Zimbabwe, the community mobilization, having legislators appreciate these issues, and push it to have the process of having the law reviewed and decriminalized. For us, the moment and this conversation is happening at the right time, because every day our legislators, the way they tried to sneak it in the marriage law in Zambia, we continue to see HIV in Zimbabwe, we continue to see HIV criminalization being sneaked into different laws. We have a specific law. We have it in our Penal Code Act. We've seen it in the Sexual Offences Bill. We saw it in the anti-homosexuality law. So every bill that comes before Parliament that has a component of sex, HIV criminalization comes in. So now the call is, let's get the science. Let's make the legislators understand it. Let's make the judiciary understand it, including the implementers and the service providers, us, the people living with HIV. How do we understand this and make it a voice that we use to push for law reform and policy change?
Thanks, Immaculate. So, Alison, you spent some time working on the case study, talking to a whole range of people, including Dr. Labodi and Immaculate and others. What I mean, in a nutshell, what do you think? What lessons do you think can be taken from what happened in Zimbabwe and that could be applied in Uganda or in Latin America, in Eastern Europe, Central Asia, even in the US and Canada, which are still fighting HIV criminalization laws? What lessons are there that we can take away?
Well, you know, one thing that really stood out to me was the broad coalition that had formed. And, you know, you saw it in the video, the cooperation and power of having parliamentarians involved and speaking directly with the ministers and having a broad range of strategies all going at the same time. That really set the groundwork in place so that when the opportunity was right, when the moment was right, they were ready to act. They had already done a lot of the education work. They had already set up the network. So that was one thing that really stood out to me, was this broad coalition. And in speaking to the activists, they talked about things they do to maintain those relationships. They don't, you know, wait until they need to call somebody up. They make sure that they're nurturing those relationships and they're supporting each other in different types of work so that they're ready when the opportunity presents. And I guess that another thing that really struck me was the messaging. It was very clear. The pamphlets that were put out were widely distributed. There were public forums repeating those same clear messages that had evidence behind them so that people could see the logic of why the law should be changed and what the situation was. So again, it was the very broad coalition expressing those same messages coherently that really, I think, got kind of the public on side. The voices of people living with HIV, really made a difference in sensitizing parliamentarians and lawmakers and people in the justice system. So those were a couple of things that stood out. And of course, the parliamentary champions being so actively involved, including, of course, Dr. Labode, I think really made a difference. But even if you don't have Dr. Labode, you can still learn from what they did in Zimbabwe and apply those lessons and be ready when opportunities present in your own country. So it's a really interesting case study and, inspiring to see success, because we have so many things in the world right now that are not so inspiring.
Indeed, Alison, thank you. I mean, that's the thing, advocacy, that movement building and law reform, they're not quick wins, but they're an essential part of the HIV response. This process took years.
Absolutely.
And I wanted to go back to Dr. Labode, and you're no longer a parliamentarian, but you are a sexual reproductive health and rights champion. And I wanted to ask about what else needs to happen in Zimbabwe so that people living with HIV and those at risk of HIV, the key populations, feel safe enough to access treatment, access services, because there's still a way to go. And not just in Zimbabwe, but in most countries, it isn't only people living with HIV that are criminalized. There are many other people affected by HIV too.
Yes, thank you very much. I'm no longer in Parliament, but I am part of the process. Because I developed this relationship with the Minister of Justice, who by default, I don't know, he came back again. He's still the Minister of Justice. And he talks to me a lot. When he wants to do something, he says, how do we push the current MPs to push some of these issues? Then I told him the truth. I said, the Parliament is polarized currently, not only on party lines, even intra-party lines. So people are afraid to talk about things because they think my party may recall me from Parliament. So a few organizations like Amnesty International started getting me as a facilitator to moderate session, share my experiences with the current sitting MPs. One of the issues even we are working on is decriminalization of sex work. Sex workers in Zimbabwe, their prevalence rate is sitting on 60%, while the nation is sitting on something like 12 or 13%. So that shows that somehow they have no access. They cannot access what every other person is accessing. So I was invited and they say, Doc, how do we decriminalize sex work? And the first thing I said was, it is in the right ministry. It is in the Minister of Justice. And already the minister had mentioned to me that law serves no purpose in Zimbabwe. Because the late Justice Chijausiku had already declared that if you want to arrest a sex worker, you must also arrest the person she was soliciting sex from. So most men would say, if the policeman came, they'll say, no,
we're just chatting, oh, she's my cousin or whatever, that will end it. So that is his own opinion. But I said, as long as the law is there in the books, one day political leadership will change and somebody will use that to really arrest people seriously. And it had happened in a place called Maswingo about 8 months ago. So we discussed, we looked at some of the strategies we can use. One big one in Zimbabwe, there's a belief that sex workers are possessed. This belief is in the Christian, it's also in our culture. They say shavere chuhure or it does less hule, meaning that you've got a spirit of being a sex worker. So my argument now, and I'm going to come back to you, Justice, you are going to help us. We want to conduct a small study, focus group discussions with church members, with a traditionalist. And I know they will confirm this because it's a strong belief. And once they confirm it, it becomes our entry point into parliament. We bring parliamentarians, we say parliamentarians, why are we allowing people who are possessed to be arrested or criminalized? So the law must go. We must then find a way, a solution to deliver people. But first of all, let's remove the law. And then also about 2 weeks ago, and another issue that came out was that a lot of we have an increase in unsafe abortions. And the unsafe abortions are actually, in most cases, you find these sex workers, when they get pregnant, they will try by all means to remove that pregnancy, hook or crook, whether it means they will push bottles or they will drink chloroquine, they will do anything, which means actually they are also vulnerable for that. So there is a court case on safe abortion, which the WILSA, an organization called WILSA, is pushing. And they have won. The High Court actually agreed with them that it is illegal to criminalize young girls who are under 18 for having gotten pregnant in a sexual relationship, which by law is illegal. So we held, then the WILSA, after winning the case, is now in the Supreme Court. They invited me to facilitate. Then I phoned the Minister of Justice. I said, I'm going to facilitate on this issue. I want to know how far we are going. He said, go. It is important because the laws are conflicting each other. And I was happy with that. We had we had 50 MPs for the unsafe abortion. And that links actually all these things. If you got pregnant, it means you slept with somebody without a condom. It comes back to HIV. You couldn't have gotten pregnant if you had used the condom. So that is the whole issue. And so we are working on those issues. I work from outside. But we have both parliament, both the speaker can call me and say, Doc, I want you to do this, and I'll do it. That's what I'm doing currently.
Well,
and I believe a lot of work we did under SADC. Civil society needs to really build capacity, because you must make MPs buy into a problem you have seen. You know that unsafe abortion is a problem, or criminalization of HIV is a problem, but the MP you have there comes from his church, comes from his village, where those things are taboo and they are not spoken about. So you have to build capacity within your own MPs and let them own these problems. One of the successes we had when we were debating decriminalization of HIV, of willful transmission, was one of the MPs whose brother had been arrested for under the same law and died in prison of TB. So when she stood up to debate, her story was so pathetic, the whole parliament went cold. People were crying tears. She said after her brother's death in prison, the mother said to them, go and look for that girl who was pregnant, who claimed my son impregnated her and infected her, so that at least we can look after the baby. When they found the lady, she said, that child was never for your brother, and leave me alone because I'm married, happily married with the father of my child. So when she was debating, she became so emotional. Tears were flowing from her eyes. She says, this law must go today. And that was so, it was so positive.
Yeah, you're really
highlighting.
Sorry to interrupt, Dr. Labadu, but you're highlighting.
I say it's because.
Yeah, you're in. I mean, that I feel your passion. I hear your, and I so appreciate one of the key points is that we need to be sensitizing. We need to be educating parliamentarians, and it's often only the parliamentarians who have a personal connection to HIV or to the issue that they're debating that really understands, and that's why it's so important to have this movement to connect advocates living with HIV, organizations working with HIV on the ground, educating parliamentarians, working with the media, so that their constituents and also agree that this is an issue that is worth fighting for, that decriminalization needs to happen. I'm just checking the Q&A, and we have a question from Fidel from Mexico, who wants to ask about what's happening in Latin America. Now, I'm not sure anyone on the panel can answer that probably any better than I can, as I'm the global coordinator of HIV Justice Worldwide. But I wanted to highlight that there is, although we've been focusing today on Zimbabwe and on the African continent, that the movements to decriminalize HIV are happening all over the world. So we work with a fantastic partner, the Zero Project, and they have a wonderful coordinator for Latin America and the Caribbean, Isis, and she is coordinating this work, and she's based in Mexico, is coordinating this work. There's actually been some remarkable changes in different laws across Mexico, in different Mexican states. They don't have HIV-specific laws, but they have a communicable disease law that's mostly been applied to HIV. And I think 4 or 5 different states in the last 2 years have actually repealed those laws. And there's actually a process in the Mexican parliament itself to repeal the law on a national level. So there is work actually happening in Mexico and across Latin America. Of course, there's work happening in North America, across the United States and in Canada. There's work happening in Eastern Europe and Central Asia, which is a hotspot for HIV criminalization. And we work with a fantastic organization of women living with HIV, the Eurasian Women's Network on AIDS there. There's work happening everywhere. Everywhere that HIV is a crime is where HIV Justice Worldwide and our partners and our supporters are working to end HIV criminalization. So we don't have an awful lot of time left, but I just wanted to go back to, first of all, to Immaculate and then to Alison for some final thoughts on what the decriminalization in Zimbabwe means to you and how we can learn the lessons in our own countries, in our own regions, in our own advocacy. Immaculate, first of all, to you.
Yes, so decriminalization in Zimbabwe means a lot for Uganda, but also for the entire Africa, the countries that still criminalize. It means a lot. And more so in the times we are in, where we are taking country ownership in ending HIV, and clearly looking from what Zimbabwe has been able to gain without criminal laws, and looking at the fact that we are saying now we need domestic funding as a country, and particularly Uganda, where I'm based, we do not need criminal laws. We now need to put our investment in ensuring that people are put on treatment, in ensuring that we are able to test those who need, who are newly diagnosed, are also put on care, and we spend less by sending people to prison. let's spend more in ensuring that we have prevention tools. Let's spend more in ensuring that we have people access treatment than sending them in prison. So for me, I wish I can carry Doctor and bring her to Uganda and put her in the parliament and tell members of parliament that laws do not work in ending HIV. What works is ensuring that we have tools that prevent, tools that are accessible, and a treatment that is there for everybody.
Thank you, Immaculate. Alison, what are your final thoughts?
You know, something that really came out in doing this case study was that people assume HIV criminalization is helpful. And I think one of the things the advocates and parliamentarians in Zimbabwe did was really show that it's not, from a justice perspective, from a health perspective, from an equality perspective. It's not meeting its objectives. So I think one of the things we can really learn from this is the importance of having logical, consistent messaging backed by science, backed by data, and just keep plugging away at it, because the advocacy did work here and it can work other places as well. Zimbabwe was one of the first countries in Africa to have an HIV criminalization law. Maybe they can also start a bit of a trend to get rid of those HIV criminalization laws. So I think that was one of the things that really stood out to me, and I hope that others will be able to learn from Zimbabwe and replicate that success.
That's great, Alison. So in the last few minutes, I just want to spend a moment to thank each of you, Dr. Labode, Immaculate, Alison, and as well as the people at the IS and the Heart of Stigma program. The translators, thank you for your beautiful work, and of course for all of you. There's been lots of information shared on this webinar. You have the links to the video, the case study, but I also want to highlight that this video and case study will be embedded in our online criminalization course in our HIV Justice Academy, which is a place you can go to. It's an online resource available in English, in French, Spanish, and Russian, where you can learn everything that you need to know about combating criminalization. You'll learn about the harms, but you'll also learn about the solutions. You'll hear from people who've been impacted by HIV criminalization, and lots of different case studies of how you can apply the lessons learned not only from Zimbabwe, but from many countries that have decriminalized or modernized their laws. So before I go, I just want to share a very brief video, 100 seconds, that introduces the HIV Justice Academy, where you can go and learn more about HIV criminalization. In our HIV criminalization online course, we will provide you with a complete global overview of HIV criminalization and all the information, tools, and resources you need to help you understand the problems of HIV criminalization and work towards a solution that fits your context. With an engaging blend of interactive text, videos, and key resources, you'll learn from the world's foremost experts on HIV criminalization, including people with lived experience on both sides of the courtroom, specialists in public health and human rights, experts in the science of HIV, and advocates and activists from all over the world who will share the lessons they learned during their own unique journeys to reform, repeal, or limit HIV criminalization laws.
And our parliament listened.
This course is totally free. You can learn at your own pace, and you'll receive a certificate of completion when you've passed the end of course test. So, if you're interested in HIV criminalization and want to learn more, then sign up for the HIV criminalization online course at the HIV Justice Academy and prepare for action. So yes, please stay involved, visit the HIV Justice Academy, prepare for action, share the recording of the webinar, which will be available at the IS Plus platform. share the video, watch the full-length video and the toolkit, and please continue our advocacy, your advocacy and our advocacy, because HIV is not a crime. Thank you again for joining us. Thank you to our wonderful panelists, and thank you to the IS for hosting. Take care.